Hello and welcome to the Hormone Insight, the podcast that brings you the latest in medical research tailored specifically for busy physicians like yourself. Today, we're focusing on the study titled A Phase 2 Randomized Dose-Finding Study of the Novel Once-Weekly Human GLP-1 Analog Semaglutide compared with placebo and open-label Liraglutide in patients with type 2 diabetes. It was published in Diabetes Care in 2016. This 12-week, double-blind, Phase 2 trial involved 415 patients with type 2 diabetes. The researchers set out to investigate the dose-response relationship of semaglutide in terms of glycemic control and also assess its safety and tolerability. So, what did this study reveal about semaglutide's effectiveness? Semaglutide demonstrated a dose-dependent reduction in HbA1c levels. In simpler terms, the higher the dose, the greater the improvement in long-term blood sugar control. What's even more impressive is that up to 81% of patients on semaglutide achieved an HbA1c level of less than 7%, a widely recognized target for good diabetes management. This is significant because achieving optimal glycemic control is crucial for reducing the risk of long-term complications associated with diabetes. Beyond its effect on blood sugar, semaglutide also demonstrated a notable impact on weight loss. Again, this effect was dose-dependent, with higher doses leading to greater weight reduction. At the highest dose tested, 1.6 milligrams, patients experienced up to 4.8 kilograms greater weight loss compared to placebo. This weight loss benefit is particularly relevant because a significant proportion of patients with type 2 diabetes struggle with obesity, which further complicates their condition. Now, looking at the safety, the study did find that gastrointestinal side effects, a common concern with GLP-1 receptor agonists, were more frequent with semaglutide, particularly at higher doses. Nausea, vomiting, and diarrhea were the most reported issues. The good news is that these side effects were typically mild to moderate in severity and tended to subside over time. Moreover, the researchers found that dose escalation was an effective strategy for mitigating these gastrointestinal issues. While the 1.6 milligrams dose showed the most potent effects, the higher incidence of side effects prompted the researchers to focus on lower doses for further studies. In their conclusion, the study authors emphasized that semaglutide holds significant promise as a potential treatment option for type 2 diabetes. It offers potent glucose lowering effects coupled with the benefit of weight loss and a manageable safety profile, especially with appropriate dose escalation. This research adds to the growing body of evidence supporting the use of GLP-1 receptor agonists in diabetes care. The once-weekly dosing of semaglutide could potentially translate into better patient adherence, which is a key factor in achieving long-term success in diabetes management. However, further research, including larger, longer-term studies, have been undertaken to fully establish the optimal use and long-term safety profile of semaglutide. We will discuss these in future episodes. That's all for this episode of the Hormone Insight. We hope you found this information insightful and relevant to your practice. Be sure to join us next time for another in-depth look at the latest medical evidence.